Doctors have known for over a decade that intimate sensitivity loss after 60 is reversible. They just never told you. Today, I am going to give you the exact 5-minute daily sequence that wakes up nerve pathways that went silent after menopause. And by the end of this video, you will have everything you need to start tonight. But first, stay with me for the next 2 minutes. Because there is a reason this works that most women never hear. And once you understand it, you will never skip a day. If you are over 60 and touch no longer registers the way it used to, write "gone quiet" in the comments right now. Or write "want it back" if you are here because you refuse to accept that this is permanent. I read every comment, and the women writing below you right now feel exactly what you feel. Let me tell you about Frances. She is 69. She came to me after 2 other doctors told her sensation loss was simply part of aging. She had stopped expecting anything different. What she did not know, what nobody had told her, was that her nerve pathways had not died, they had gone to sleep, and sleeping nerves can be woken up. 8 weeks after starting this 5-minute sequence, she sent me 3 words. Something is waking. That is what today is about. Subscribe to this channel and turn on notifications if you want more of this kind of honest, practical information that most appointments never have time for. Now, the part most women are never told. Your intimate sensation travels through nerve fibers that are coated in a protective layer. Think of it like the rubber coating on an electrical wire. After menopause, that coating thins. Signals that used to arrive strong and clear now arrive faded, like a phone call breaking up. The touch is there, but the signal barely makes it through. Here is the open secret that changes everything. Nerve pathways respond to consistent use. Use them daily, and they strengthen. Ignore them, and they fade further. This is not a theory. This is how rehabilitation medicine restores sensation after nerve injuries. Applied to your intimate nerve pathways with the right daily sequence, it works, and nobody told you this was possible. Before I walk you through the 3 components, I need to tell you what happens in your first week that surprises almost every woman. You will feel almost nothing at first, and that is exactly correct. The first 2 weeks are not about sensation. They are about sending a signal, a daily message to your nervous system that says, "This pathway is being used." Keep it, maintain it, strengthen it. The sensation comes after, and when it comes noticeably. Here is another thing nobody mentions. Most women over 60 carry chronic low-level tension deep in their pelvic region. A protective holding pattern built up over years of discomfort, guarding, or simply forgetting that area exists. This tension physically compresses the nerve fibers. It is like squeezing a garden hose. Even if the water pressure is good, the flow is blocked. The first component of this sequence addresses that compression directly. And for many women, it produces the first real change they have felt in years. I will explain exactly how in a moment. Now, the 3 components. Do them in order every single day. Morning is ideal. 5 minutes total. Component 1 is pelvic release breathing. 90 seconds. Lie on your back, knees bent, feet flat. One hand rests lightly on your lower abdomen. Take 4 slow, deep breaths. On every single inhale, consciously release the entire pelvic floor downward. Not a squeeze, not a Kegel. The opposite. A deliberate, conscious letting go. Imagine the entire pelvic region softening and widening with each breath in. Why does this matter so much? Because releasing that chronic compression decompresses the nerve fibers running through your pelvic region. Blood flow improves immediately. Oxygen reaches nerve tissue that has been partially starved of it. And you are training your nervous system to associate this area with openness rather than guarding. This is the preparation that makes everything that follows more effective. Most women find this component harder than it sounds. Consciously releasing the pelvic floor is a skill, one that was never taught and that most women never knew they needed. By week 2, it becomes noticeably easier, and by week 3, many women describe feeling something shift during those 4 breaths. A warmth, a softening, a sense of contact with a part of their body they had lost connection to. Component 2 is thermal activation. 90 seconds. Prepare a small clean cloth soaked in comfortably warm water. Hold it gently against the external perineal area for 90 seconds. No pressure, no movement, simply warmth. Here is what is happening beneath the surface that makes this more than just comfort. Warmth causes the tiny blood vessels supplying your intimate nerve branches to open wider, more blood, more oxygen, more efficient nerve conduction. But more importantly, warmth activates a specific class of sensory nerve endings called thermoreceptors. Every time you activate them, you send an activation pulse along the entire nerve pathway. Done daily, this consistent, low-level activation begins to rebuild the nerve's conduction capacity from the outside in. Women who notice their first sensitivity change, and most do between days 14 and 21, almost always describe it during this component first. A warmth that suddenly feels more present, more registering, more like something than it did before. That is the nerve pathway beginning to respond. Component 3 is progressive tactile stimulation. 2 minutes. Using clean fingertips with a small amount of rice bran oil or pure vitamin E oil, apply the lightest possible touch to the external perineal area. Feather light, not a massage. Think of the pressure you would use to touch a soap bubble without breaking it. 30 seconds of slow circular movements. 30 seconds of gentle upward strokes. 30 seconds of the lightest possible tapping. 30 seconds back to circular. Why this specific pattern? Because each movement type activates a different class of nerve fiber simultaneously. Circular pressure, directional strokes, and light tapping each speak to different nerve ending types. By cycling through all 3 in a single session, you are activating the broadest possible range of the nerve pathway, multiplying the use-dependent plasticity signal and accelerating the recovery timeline significantly compared to any single technique alone. Here is the open loop I promised to close. That first week when you feel almost nothing, what is actually happening inside your body during those 5 minutes is this. Each session sends a measurable electrochemical signal along the nerve fiber. That signal stimulates the cells responsible for rebuilding the protective nerve coating to begin synthesizing new material. They do not respond overnight, but they respond cumulatively. By day 10, they are measurably more active than on day 1. By day 21, the first new coating is thin but present, and by week 6, the conduction velocity along the most stimulated fibers has measurably improved. And this is not a metaphor, this is peripheral nerve physiology, and it is happening in your body every single time you do this sequence, whether you can feel it yet or not. Frances at week 7. She used the word conversation. "It feels like a conversation with my body," she said, a conversation I thought had ended. 2 things that amplify this sequence significantly. First, take 1,000 micrograms of sublingual methylcobalamin B12 every morning before starting. B12 is the primary nutritional building block for nerve coating synthesis. The sublingual form dissolves under your tongue and enters your bloodstream directly, bypassing the absorption problems that make standard B12 tablets almost useless for women over 60. Taking it immediately before the sequence aligns its peak absorption with your nervous system's active period. Second, do not miss a single day in the first 4 weeks. The plasticity signal is cumulative. 2 missed days in week 2 sets back the adaptation timeline by approximately 5 days. After 4 weeks of daily consistency, you can move to 5 days per week as maintenance. The honest timeline. Weeks 1 and 2, almost no sensation change, but the neurological foundation is being built. Week 3, first perceptible sensitivity appears, usually during the thermal component. Week 4, sensitivity extends to the tactile component. Weeks 5 and 6, sensitivity begins appearing outside the exercise in daily life. Weeks 7 and 8, the recovery becomes something you notice and trust every day. Here is your action plan. Tonight, buy rice bran oil and sublingual methylcobalamin B12. Tomorrow morning, do your first session. 90 seconds of pelvic release breathing, 90 seconds of warm cloth, 2 minutes of progressive tactile stimulation, 5 minutes every single morning for 8 weeks. One thing I want to leave you with. For years, this area of women's health received almost no clinical attention because nobody was asking the question, can intimate nerve sensitivity be recovered after menopause? The answer is yes. It has always been yes. Your nerve pathways did not die. They went quiet because nothing was using them. You are about to start using them again. Share this with a woman who went quiet and gave up. Leave me your comment. I am Dr. William Harrison. 5 minutes, every morning, 8 weeks. Your body is waiting to answer. I want to address something that comes up for almost every woman I teach this sequence to. At some point in the first 2 weeks, usually around day 5 or 6, there is a moment of doubt. The sequence feels routine. Nothing dramatic has happened. And the quiet voice that has been telling you your body is simply too far gone starts to get louder. I want to name that moment now so you recognize it when it arrives. That moment is not evidence that this is not working. That moment is precisely when the nerve cells responsible for rebuilding your conduction capacity are beginning their most active work. Work that is happening below the threshold of conscious sensation. The doubt arrives exactly when the biology is most actively responding. Push through day 5. Push through day 6. The women who do are the ones who reach week 3 and feel the first unmistakable shift. There is also something I want you to understand about why this particular sequence, in this particular order, produces results that other approaches do not. Most women who attempt any kind of self-directed intimate care skip the release breathing entirely and go directly to stimulation. This is the single most common reason attempts fail. Without releasing the pelvic floor compression first, the nerve fibers remain partially constricted. The tactile stimulation signal cannot travel as efficiently through compressed tissue. By consistently beginning with the breathing release, even when it feels unnecessary, even on days when you feel fine, you ensure that every tactile signal you send in component 3 travels through decompressed tissue with maximum conduction efficiency. The order is not a preference, it is the mechanism. Component 1 enables component 2. Component 2 prepares component 3. Skip the order and you lose a significant portion of the benefit. One more thing that most resources never mention. Emotional safety matters neurologically for this kind of recovery. Your nervous system cannot fully activate sensory pathways in an environment of tension, self-judgment, or distraction. The 5 minutes of this sequence work most powerfully when done with a genuine quality of attention. Not multitasking, not mentally running through your day, not judging whether you are doing it correctly. Simply present. Simply curious. Simply giving your body 5 minutes of unhurried attention that it has probably not received in a very long time. This is not a soft suggestion. The neurological literature on sensory rehabilitation consistently identifies patient attention and presence as measurable factors in recovery rate. Give the 5 minutes fully, not just physically, mentally. Your nerve pathways are listening for more than just touch. They are listening for your attention. Frances came back at 12 weeks, not 8. She had kept going past the 8-week mark because, her words, she wanted to see how much further it could go. She said that by week 12, the sensitivity was at a level she had not experienced since her early 50s. Not identical, but genuinely, measurably, joyfully present. I thought this was something I had to grieve, she said. It turns out I just had to be patient with it. Your body has been patient with you. Now it is your turn to be patient with it. 5 minutes every morning, starting tomorrow. Let me tell you the one thing about this sequence that surprises women the most. not what it does to their intimate sensitivity, but what it does to their relationship with their own body. Almost every woman who completes 8 weeks of this protocol describes a shift that goes beyond the physical. They describe feeling more at home in their body, more present in it, less estranged from it. This makes complete neurological sense. Consistent, gentle, attentive daily stimulation of a body region that has been ignored or avoided for years does not just rebuild nerve conduction. It rebuilds the neural representation of that body region in the brain's internal map of where your body is and what it can feel. When that map has been neglected, the brain gradually reduces the cortical space devoted to it. Daily stimulation reverses that reduction. The brain begins to reattend to the area, and as it does, the subjective sense of connection, of inhabiting that part of your body again, returns alongside the physical sensitivity. Frances called it finding something she had lost without realizing she had lost it. What she found was not just sensation, it was herself. And that, more than any clinical outcome, is what this 5 minutes a day is really about.